Well, when a man hears that he has prostate cancer, of course, that's a big setback, hearing that word cancer. But the first thing that the doctors do when they make a diagnosis of any kind of cancer is to find out where is it. And then there's a process called staging, a staging evaluation. And most of the time that's stage 1, 2, 3, or 4. And if the cancer is very localized, then we have a certain set of treatments that would be appropriate. And if it looks like it's a little more widespread, then we would use different treatments. Most of the patients that I see have early stage disease. So it's localized, and we're talking about treatments that hopefully will cure their cancer. And usually that consists of either surgery or radiation. And I'm a radiation oncologist, so they come to talk to me about radiation. This feels like so much more of an emergency than it really is. And you'd have to just take a step back and get the information and let it have a chance to settle, especially with prostate cancer. It is a slow-growing cancer. You don't need to have surgery tomorrow. You don't need to start radiation tomorrow. You need to find out what your options are and choose the one that's going to be the best for you. Well, for localized prostate cancer, the most common options are surgery, called radical prostatectomy, or radiation, IMRT radiation treatments. There are radiation implants, and then there's active surveillance. Some guys actually don't need treatment for their prostate cancer. Because it's so slow growing, we can just watch it carefully and just make sure that it's kind of behaving itself. My goal is to get them the information that they can use to make the decision that's the best, because whatever they decide, whether it's surgery, whether it's radiation, whether it's active surveillance, once they head off down that path, I want them to have a sense, as best they can, that that's the right way to go. They'll never know for sure, and there'll always be that little bit of uncertainty in the back of their mind, but they have to feel as good about that as they can. And if we can get them to that point, then we've done our job.